Medication time is teaching time. Help them do what they can do on their own. All right. So, Stephanie here. Let me just shut this door. I have been a nurse since 2007. I graduated and been teaching faculty since 2013. For context, I am in the state of Massachusetts. So my regulations, when I get into specifics, have to deal with Massachusetts, the Medication Administration Program. Okay. So a lot of other states call it Meditech or medication aid. So let's get to it. Some principles of medication administration, 3 things you want to remember. You want to remember mindfulness, supporting abilities, and communication. Mindfulness, supporting abilities, and communication. So let's break it down. It's very simple, okay? You are taking care of people and giving them medications, which is a huge, huge deal, okay? So what you want to do, mindfulness, think about it. You want to make sure that you're alert, that you're focused on what you're doing. And now what I find, a lot of people don't go in to harm somebody. It could be that I've worked at the same group home for 5 years. I know all of these medications like the back of my hand, and that gets to some complacency where you don't follow the protocol the way that you should. Maybe the television's on in the background or the radio's on, or staff are laughing in the background. So you're supposed to go to a quiet place of the home or the facility, turn off the TV, turn off the radio, put your phone down, and really focus in on what you're doing. So that is what we mean by mindfulness, okay? Supporting abilities, whatever the patient is able to do for themselves, you should let them do. So for example, I was Director of Health Services for DDS, Department of Developmental Disabilities Group Homes, right? And so with that, there are people that have different capabilities. There are patients staff would bring to the doctor, and the patient themselves are able to say, I have a headache, that's why I'm here today. And so if a patient's able to say why they're there, you shouldn't jump in and interrupt them, okay? Because you should let them do what they're able to do, and you come in at the point that they're unable. So with that, there's a spectrum. You could have a group home with people who have different abilities. Some people might be nonverbal. Some people might be very articulate. Some people might like to hold their pills and take it themselves. Some people maybe can't hold the cup. Whatever, I had group home where some people administered their own medication, okay? So if someone's able to administer their own medication, and it's called self-administration, it would be wrong to go take it from them and do it yourself. So supporting abilities, you let the resident, not the patient, because they are in a group home, that's their home, it's not a hospital. So the resident or your client, a lot of times is the more appropriate term, allowed and should be allowed to do what they are able to do safely. And then you jump in when they need assistance. So that's supporting abilities. The third part is communication. You have verbal communication, like I'm speaking to you now over video, and you have written communication. So with your MAP certificate, being a MAP staff, you have to take in and hone in all types of different communication forms, meaning that you are going to get written doctor's orders and pharmacy labels and things like that. That is written communication. You have to make sure that you communicate with staff on another document via a written method, okay? When you transcribe. When you give report to the oncoming staff or your supervisor, you are communicating orally, you're telling them what happened. Sometimes a combination of both. So you want to make sure your communication skill in all different manners is up to par, because it's the transfer of information to make sure nobody stays in a group home 24 hours, right? You probably have a morning shift, an afternoon shift, and an overnight shift, and you don't want anything to fall through the cracks, meaning meds get missed, or harm comes to the patient because staff did not communicate appropriately with one another. Another thing I'd like to add to the communication, you're communicating with doctors, you're communicating with other members of the healthcare team, you're communicating with the client themselves, you're communicating with the client's family. There's a lot of moving parts, so you have to make sure that you're up on your communication skills. All right, so take a look. Please like and subscribe. Click the link down at the bottom, and we will able to get you questions to help you pass your state exam. Don't forget to be essential. All right, take care. Bye.